Hi, my name is Natalie Dinh. I'll be discussing the lack of pediatric mental health resource availability in the state of Nebraska. I am very passionate about this topic because there are a handful of people that I know who suffer from mental health issues. I wanted to do research on what is already been explored and come up with ideas on how we as a community can improve on our mental health. After all, it starts when we are children and carries with us into adulthood. This is the very reason why I strive to help and understand the patient I care of, because we all experience some type of mental health problem once in our lifetime. My first effective communicator experience while I was in nursing 340, I had to take care of adult patients for 1 month and pediatric patients the following month. And these two populations are very different if you think about it. One factor that stands out is how you communicate with them depending on their age. Therefore, it is critical to know how to use verbal communication in many different ways depending on the situation in order to achieve mutual understanding. The person listening skills also play a big role in verbal communication to ensure he or she understands what the other person has to say by asking open ended questions. You can obtain more information that way to help you learn more about someone. Thus, I give myself a competent rating because this skill helped me choose what to say more carefully. It also helped me avoid miscommunication with people. You cannot disassociate body language from verbal communication because they go hand in hand with one another. When it comes to mental health within the pediatric population, it affects the children's cognitive thinking skills, behavior, and emotions in ways that make it harder for them to sympathize with others, manage stress, and make the right decisions. How I can use what I learned about being an effective communicator to address the issues, to use my abilities to communicate effectively with my patients no matter what their age is, and to provide education about what resources are available within the community where they reside. As healthcare workers, need to remember that it is very easy for someone to misunderstand what is being said to them, especially if their culture is involved. Without having effective communication with our patients, it is impossible to know how they are feeling. This could lead to an issue deciding what to do to make them feel more comfortable. So, communication is key when it comes to providing great care to our patients. A second effective communicator experience um, is using critical thinking to produce, associate, and establish ideas in written, oral, and nonverbal manner. These skills assets are also utilized when trying to translate words and phrases into another language. I had the opportunity to work on an elderly project for Nursing 462. I decided to do it over my father in law, who was willing to take some time out of his day to participate. The most challenging part of the project was being able to translate the questions to Vietnamese so that he could understand and answer them appropriately. There are a handful of words in English language that cannot be translated to Vietnamese because there is no word in the Vietnamese language for them to be translated. I found myself having to ask the same question two or three different ways for him to give me the answer I was looking for. What I ended up doing was coming up with examples that would guide him in the right direction. Reflecting back on my nursing experiences, I have realized that the more knowledge and hands on experience I gain, the more confident I am in communicating with my patients, healthcare team members, clinical instructors, and fellow classmates. Communication is the key to achieving success when working in the healthcare field. Not only is it important to an effective communication with patients, but also those skills when working with other healthcare professionals. One misunderstanding between two healthcare faculty members could put the patient at risk for unintentional bodily injury. I believe I have shown growth in how I communicate with others by asking alternative methods to ensure that the patient understands the information that is being shared and taught. I was able to catch nonverbal cues by paying attention to the length of pauses and the way my father in law was breathing. The skills I gain will be carried with me and be used time and time again throughout my nursing career. I would also be open minded and try different tactics that would benefit the patient. To become an effective communicator, one must be willing to sympathize with each patient they are taking care of, such as patient's pain level and what suffering looks like to them. If healthcare professionals tried to understand what their patient's health condition was, how much pain they were in, and what they might be going through, they would act and perform tasks a certain way. Major issues in assessing healthcare services for these families are the following: language or interpretation services, distance and travel, financial burdens, and lack of appropriate providers in the area. Becoming a compassionate individual would make patients feel more comfortable opening up more. This would be ideal because they might share information that might help physicians find the cause of their health issue that the patient's family might not know about. Furthermore, helping patients and coworkers in need without having them wait for them to ask will make us feel a lot better about ourselves. Hence, true happiness is not about our own emotions, but everyone else's around us. That helps spread positive vibes to other people who are on the unit. My first reflective individual experience, I had the opportunity to reflect on what it means to become a nurse when I was taking Nursing 240. I have learned that there are multiple rationales behind what is actually going on with the patients. My NICU nurse had taught me that every nursing assessment procedure, medication administration, and so on for the neonates made a significant difference. Everything that they did, whether it is big or small, truly counts, and how imperative it was for the neonates to receive great care. To be a reflective individual means persistently challenging your knowledge, beliefs, past experiences, and the actions that were taken in order to improve your way of thinking. By asking questions, I was able to view the experience not only as a nurse providing care, but also from the perspective of neonates receiving care. I came to understand that the nurse's job is to advocate for the neonates in order to promote better health outcomes for both the mom and infant. Therefore, the experience showed me the importance of putting aside my own assumptions in order to provide the best care possible for my patients. A nurse's ability to use empathy to better understand the patient's situation is critical. This experience challenged me to place myself in the neonate's position and think critically about the kind of care I would want to receive. By having this knowledge, it will help me challenge my critical thinking skills and change my perceptions about the type of care that the patients receive. The child's physical illness, poor maternal mental health, how many children are living in the home, and challenges in the number of patients living at home can affect the onset of developing emotional disorders. Low income status, low maternal education, living in a reconstituted family, challenges in maternal mental health over time, and child's needs for special education affect the onset of developing conduct disorder. Low socioeconomic status, poor maternal mental health, and rented communication affected the duration of mental disorders. Hence, it is important to let the patient and the patient's family members know that they are not alone. We need to ensure that they know that they can always count on one of the healthcare professionals if they ever need anything, whether it is assistance to the restroom or needing someone to talk to and are listened to. As a result, healthcare professionals can alleviate one's suffering by first eliminating one's own desires, treating others with respect, and performing good deeds that will spread positive vibes to their patients, thereby alleviating their pain and suffering. My second reflective individual experience, I had the pleasure of teaching beginner health profession students how to take vital signs. This experience has brought old memories from when I first started nursing school. I reflected back on what was going through my mind and how nervous I was taking. vital signs for the first time. I wanted to share some tips that I had learned along the way that I wish someone had told me when I first started out. I wanted to make sure that I communicated to the students in a way that they could understand what I was talking about and adjust based on their knowledge of the subject matter. I made sure that the students were comfortable with and accepting of the strategies I was sharing with them. I wanted the students to know that they could make mistakes and ask questions if they were unsure about something. I was very understanding and had the patience to teach each student how to improve in areas he or she was struggling in. To my surprise, the majority of the students I had taught were able to take an accurate blood pressure reading on their first try. By the end of the teaching session, the students walked out feeling confident in their healthcare skills they had learned. This community learning service experience has helped me by allowing me to reflect back on the first time I started my nursing journey. I was able to remember what it felt like to enter a field where I had no experience and the compassion for other students to understand where they were coming from. This guided me in the right direction as to how I should teach others. It also gave me an opportunity to share what I had learned over the years that had helped me improve my nursing skills. I was confident in what I was teaching. It made me feel good about myself to see other students succeed. It is estimated that 1 out of 5 children living in the United States experiences a mental illness every year. This amounts to the approximately 247 billion a year that the community, families, and sole individuals must fund, putting a financial burden on them. Therefore, it is important to reflect back on our mistakes and share information that would aid others in success so that they can avoid making those same mistakes and motivate them to reach out to available resources that can aid them in their situation. To become a reflective individual, a person has to be willing to make changes to improve and grow. It is also vital to be able to communicate with others, healthcare faculty members. Hence, to be a reflective individual, you have to be a change agent and an effective communicator. You cannot be one and not the other. These three characteristics define what a great nurse should be in order to provide great care for their patients. My first change agent experience, I had experience in nursing 340 that I didn't believe I should have had. I was told that I lacked confidence when caring about my patients. This information was shared among other faculty members who treated me in a negative way. One clinical instructor documented negative feedback in my signed Google document without attempting to reach out to me to discuss some of her concerns and gather some information for clarification. This negative experience has made me feel like I was devalued and that I was not good enough to continue to pursue my education in the nursing profession. It made me rethink if I had made the right decision to become a nurse. However, after seeking support, I received some great advice. There are only a few people who think I am not fit to be in this profession. They don't know who I am as a person, what I did to be where I am now, or how badly I want this nursing degree. There are different types of nursing jobs out there. I just need to find the right one where I belong. Only I can make that decision if I become a nurse. So when I was at the children's hospital, I took care of a 3-month-old boy and needed who needed heart surgery. I was confident in what I was doing while taking care of him. I wasn't paying attention to the clinical instructor who was watching my performance. At the end of the day, my instructor told me that I took charge while my partner stayed back watching. She told me I did a great job, how she was not worried about my clinical performance, and how I should not listen to what other people think, even if it is an instructor. I am a great example to my 3 children of a change agent, no matter how tough the class was, no matter what the professors said. I was able to take their comments and prove that they were wrong about me. I refused to believe that he or she to say and manage to show my clinical professor and myself that I could be a great nurse. Taking this class has taught me how comfortable I am with taking care of pediatric patients versus adult patients. Without taking this class, I would not have known how much I liked taking care of pediatric patients. Therefore, as a nurse, I would be a great example of a change agent for my patients, because no matter what the circumstances were, I did not give up. How I can use what I learned about being a change agent to address my public issue is to know when to speak up, to make a valid statement, to implement a need for a change. An example that would be beneficial in increasing access to pediatric mental health services, to define and clarify the role of the school in addressing the mental, behavioral, and emotional issues. It would be helpful if the schools organized an educational campaign among the school staff members, students, and their parents and community providers. In addition to collecting using children's mental health indicators to develop supportive policies, implement prevention and intervention programs, and improve student health. After countless trials and errors, I have grown to master the skills I require to aid me in taking care of my patients as a whole versus just looking at their diagnosis and labs and worrying about the administration of medications and treatments itself. I have taken notice that a lot of nurses I have shadowed lack compassion and patience with their more difficult patients. Instead of spending the time determining why their patient is having a bad day, the nurse will try to avoid entering the patient's room until they are required to do so. One of the nurses' responses to the patient's reaction was how the patient must only respect people of higher authority, like their medical doctor, and not so much their nurses. But if it was the case, then why was the patient nice to their nursing assistant and nursing student? I spent most of my time in my patient's room to learn that the patient did not like his nurse because the nurse did not want to listen to what he had to say. In addition, both of his ears were hard of hearing. Even though the nurse reassured the patient that she was not mad, he stated that he could still read body language, knew when the nurse was lying, and how she was indeed angry. Both the nurse and the patient had a bad first impression of one another. For this reason, the patient refused to adhere to what the nurse asked, and the nurse refused to enter the patient's room unless she really needed to. Sometimes all the patient needs is to get things off their chest and have someone listen to what they have gone through to feel better. It is easier to share with someone you hardly know than it is to share with a friend or family member. For this reason, they tend to judge you straight away with either having something negative to say or making unwanted suggestions. Not only have I grown from my past experiences throughout my clinical rotation, but I have also learned to communicate in a way that my patients will put their guard down and share their personal life experiences with me. Having this capability takes lots of dedication, time, repetitive, and putting myself in my patient's current situation to comprehend how they are feeling. I've learned not to judge my patients based on what the nurses say during morning rounds because what they've experienced with their patient may not always be the same for me. One important component that is fundamental is utilizing exceptional communication skills with everyone that I interact with, along with verbal and nonverbal communication. It is also vital to apply your listening skills to get the patients to willingly listen and do what the healthcare professional asks of them. Therefore, to have the ability to alter each person's opinion and attitude, I would likewise have to adjust my own point of view, outlook, energy, and interactions to be successful. I will continue to improve the skills I have gained from nursing school at, at several healthcare faculties and within the community while passing along my knowledge to other nursing students, patients, family members, and healthcare staff. How I can use what I learned about being a change agent to address my public issues is to reflect back on the mistakes and figure out a solution to resolve the issue to prevent future mistakes. Everyone will make their own mistake, but that is how we all grow and learn. Due to the unmet need for mental health, behavioral health services in the children and youth populations within the state of Nebraska, we need to make the issue known. An important factor in becoming a change agent is being able to speak up for what is right and being willing to accept criticism and make adjustments to improve as an individual. Therefore, it creates an opportunity to also pass the knowledge on to future prodigies. In conclusion, we talked about how effective communication is key when it comes to proving great care to our patients. One must be willing to sympathize and be compassionate towards her patient for them to feel more comfortable to trust us and share vital information. Also, providing education about what resources are available within the community where the patient resides. We also talked about the importance to let the patient and their family members know that they are not alone, how they can count on one of the healthcare professionals if they ever need anything. Also, it is important to reflect back on our mistake and share information that would aid others in success so they can avoid making those same mistakes and motivate them to reach out to available resources that can aid them in their situation. To become a reflective individual, a person has to be willing to make changes to improve and grow. We also talked about knowing when to speak up to make a valid statement to implement a need for a change. A change agent needs to be able to speak up for what is right and being willing to accept criticism and make adjustments to improve oneself. Therefore, to be a reflective individual, you have to be a change agent and an effective communicator. You cannot be one and not the other. These three characteristics define what a great nurse should be in order to provide great care for their patients, and I believe that I have become that. Here's my references. Thank you.